Our next speaker is Imane Khachani. She's going to be speaking. The title of her talk is Don't Just Do Something, Simply Do Everything. Imane Khachani is a resident in Obstetrics and Gynaecology at the Maternity Hospital Les Orangers in Rabat. She has experience in sexual and reproductive health research and advocacy and has worked with several UN agencies, including UNFPA, WHO, and UNAIDS. She's currently on the board of directors for Women Deliver and the Guttmacher Institute. Please welcome Imane Khachani.
Thank you, Michelle. Assalamu alaikum. It's very challenging to take the stage after such inspiring speeches. I really don't know what to say and what to do now, but I'm going to try to be competitive and take you through a journey to my part of the world and to where I get, as a specializing obstetrician, to spend most of my time, and that's the maternity hospital delivery ward. Don't worry, I'll spare you the screaming, I'll spare you the not-so-pleasant smells, and my fellow midwives and obstetricians know certainly what I'm talking about. But I want to take you there because this is where all the vulnerabilities, all the disparities, all the discriminations suffered by women come to light and translate into terrible pain, fear, anxiety, lifelong morbidities, and sometimes even death. Maternal mortality evokes something to each one of us. It's a statistic, a ratio, an MDG, a fund, a conference, Women Deliver. It's all of that, of course. But to me, it's a name, it's a face. And today, I'm going to take you to a journey through the life of a patient I lost from childbirth complications. Her name is Fatna, and you'll go with me through her journey from pregnancy to death, from intending to give life to losing life. I can still see her dragging her feet into the delivery ward. Her lips twitched in pain, her eyes filled with fear, despair, anxiety. 42 years old, 9 gestations, 7 parities, active phase of labor. This is how she was introduced to me, numbers. And I was soon to realize that Fatna was going to become a number as well in my country's Ministry of Health statistics. I looked at her as she handed over to me a wrinkled envelope with a low-quality ultrasound picture and a syphilis screening test. And that was it. That was all the prenatal care she had received. I looked at her, and my eyes were telling why. She lowered hers and mumbled a few words. Couldn't understand much of it, but I could grasp mistake. So I wanted to know more about that mistake. Tell me more, Fatna. Why was it a mistake? Fatna never wanted to become pregnant. She already had 7 children. She was 42 years old. Her husband had a stable job. She knew she could get some pills at the nearest healthcare center, but she had heard her neighbors tell terrible stories about these pills giving cancer and all sort of horrible things. So she never went for that. A volunteer midwife or nurse, I can't much remember, visited her someday and suggested she uses an IUD. But her husband categorically refused because he had heard some of his friends laugh about stories of one of the T branches of the IUD injuring the penis during sexual intercourse. So she went for the rhythm method. And it worked till she found herself pregnant again. Maktub, she concluded, which means in Arabic, destiny. The labor went pretty quickly, and she delivered a lovely boy Yeah. But soon after the placenta delivery, she started bleeding and bleeding and bleeding. It was impossible to palpate her uterus through her abdomen, and the color of her skin had dramatically changed. Postpartum hemorrhage. Oxytocin, uterine massage, misoprostol, getting the operating theater ready for hysterectomy, blood transfusion, transfer of the patient to the intensive care unit. It all went so quickly. And a few hours after that, we got that call we never, as obstetricians, want to get from the IUC unit. Fatna hadn't survived. Hour of death, 12:46. Good night. And that was it, the end of the story. My friends often ask me, do doctors grieve when their patients die? Yes, we are human beings, so yes, we do grieve. And the death of Fatna left me with profound feeling of sadness, failure, and powerlessness. I chose to become an obstetrician because I wanted to be the doctor who announces life for women who choose to give life, not the one who announces death. A few weeks later, I ran into her husband. I went immediately to him. I wanted to talk to him. I felt that we were connected by the loss of this person. And I wanted to know more, who was Fatna? Who was that woman who died in my hands? Fatna was born in a rural village about 60, 70 kilometers away from Rabat, the capital city of Morocco. She was never sent to school because, and he laughed when he said to me that, in these parts of the country, the only school for a girl is the kitchen, till the family finds her a good husband. And they did, eventually. It was him, of course, and married her at the age of 15. And 11 months after that, exactly, their first son was born. Wow, 11 months. That fast? He laughed again. Well, doctor, you have to prove that the lady's fertile. And indeed, Fatna gave excellent proof of her fertility. 9 pregnancies, among which 2 miscarriages and 7 full-term pregnancies, the last one taking her last breath. As I kept thinking about the life of Fatna, I couldn't help but think, Fatna did not die from postpartum hemorrhage. I mean, of course, yes, this is her tag as she becomes a Ministry of Health statistic. But Fatna did not start bleeding on my obstetric labor table. Fatna started bleeding way before that. She started bleeding when her parents did not send her to school, and when she didn't receive the education to make her an empowered person that chooses the life she wants to have. She started bleeding when she was married at the age she could still be playing hide and seek. She started bleeding when she had her first child, being a child herself. She started bleeding when she could never decide if and when to get pregnant, when she could never get the care she needed because she had no knowledge, no skills, and no resources to do that. This is what killed Fatna. And this is what continues to kill women every day all over the world. Maternal mortality does not just happen. The sexual and reproductive health of women and girls are a lifetime concern. And they don't start when uterine contractions start. They sometimes start as soon as when the announcement it's a baby girl is made. Because in many parts of the world, that announcement still falls as a social death sentence and a discrimination sentence. So, as you leave Kuala Lumpur, I won't have the pretension to ask you to remember my story. I'm sure you've heard many other inspiring stories. I will just ask you, remember that acting on women and girls' health is not one thing. So don't do just one thing. Do everything. Thank you.